The Infected Blood Inquiry, a comprehensive overview. The Infected Blood Inquiry, a meticulous investigation spanning 6 years, is poised to unveil its comprehensive findings in a seismic moment for the victims and their families. This landmark report will chronicle the tragic events that led to the deaths of over 3,000 individuals and shattered countless lives. A history of negligence and suffering. Over a harrowing 2 decades, more than 30,000 hemophiliacs and transfusion recipients fell victim to HIV and Hepatitis C infections due to contaminated blood products. This scandal, considered the darkest chapter in the history of the NHS, has left an enduring scar on the UK's healthcare system. During the 1970s and 1990s, patients seeking medical care in the UK were exposed to tainted blood. Childbirth complications and hemophilia treatments exposed individuals to blood products sourced from the United States, a practice that carried inherent risks. Regrettably, HIV screening was not implemented until 1986, and hepatitis C testing commenced only in 1991. U.S. blood imports and high-risk donors. The U.S. blood products imported for hemophiliac patients posed a significant threat. In an ill-conceived move, donors were financially compensated for their contributions, inadvertently enticing individuals with high infection risks, such as drug users, sex workers, and prison inmates, to participate in the donation process. Warnings ignored, key files destroyed. Despite ample warnings from the World Health Organization highlighting the dangers of unscreened blood and imported products, these concerns were disregarded. Even more alarmingly, test results revealing HIV infections were concealed from victims. To further obstruct justice, key files were destroyed at a time when the threat of legal action loomed. Accountability and compensation. The inquiry is anticipated to assign blame to those responsible for this catastrophic scandal. Pharmaceutical companies' greed, government negligence, and a culture of cover-ups will likely be held accountable. Victims and their families seek acknowledgement that this tragedy could have been averted and a commitment to prevent such horrors from recurring. Government response and compensation plan. The government is expected to deliver a detailed response to the inquiry's findings later this week. Rishi Sunak, the Chancellor, has already issued an official apology to victims and their families, acknowledging their justified anger towards politicians, including himself, for failing to address this issue sooner. A compensation package exceeding £10 billion is anticipated, with payments expected to commence as expeditiously as possible. Jeremy Hunt and Keir Starmer, representing the Conservative and Labour parties respectively, have pledged unwavering support for justice and compensation. Political consensus and demands for swift action. A rare display of political unity has emerged, with both parties recognizing the urgency of addressing this wrong. Labour leader Keir Starmer has condemned the delay in justice, vowing to work alongside the government to expedite the compensation process. Consequences and legacy. The inquiry's conclusion will likely lead to the referral of documents to the Director of Public Prosecutions, who will consider the possibility of criminal charges. High-profile calls for corporate manslaughter charges have been made, mirroring France's approach in a similar scandal. Victims and families remain hopeful that the inquiry's findings will foster transparency, accountability, and compassion in the public service. They demand that such a betrayal of trust never occurs again, and that lessons are learned to safeguard future generations. The Infected Blood Inquiry stands as a sobering reminder of the devastating consequences of negligence and misconduct within a healthcare system. Its report will undoubtedly leave a lasting impact on the UK, shaping the future of patient care and accountability in healthcare institutions.